Hello, and welcome to another F.L.O.E discussion session. Today's topic, depression awareness. How much do you know about depression? Can you tell the signs? Today we'll be chatting with Dr. BP Maphala, and we'll get to learn more about the finer details of depression.
My name is Dr. Maphala. Today's class was going to be on depression. But as you can see, I did not highlight depression from my first slide because I'll be talking about an overaching pain that people are actually struggling from, which also involves the depression. I think over the years or recently, we can see that there are a lot of things that are happening that might have the potential to actually affect people, whether physically, emotionally, socially. And I just felt that the impact of whatever is happening has actually locked us into chains. So whenever I want to address the issue of depression, I talk about unlocking the generational chains. This did not start with us. But if you look at the intensity of the disease or of the state of mind at the moment, a lot of people tend to be struggling from what we call the depression. Okay. So today's class was going to address those issues of depression, but it was just an awareness class. It wasn't about training somebody to be a counselor to go and counsel depressed people or for you to have a full understanding of depression, but it was just an awareness to say, let's start the conversation about what depression is all about. I think different people have got different views, and that's acceptable. Um, and when we trace depression, it also comes from mental health. So it is a mental health issue. So and again, when I talk about the chains in our society, people associate mental health with chains, and that's why people who are psychotic, people who they refer as abnormal, sometimes you find them in chains. And with this presentation is just a figure of speech. I'm just saying, in our minds, in our thinking, we cannot function optimally because of the chains. So when we want to start transforming depression, we need to look at the chains and say, how do I break myself out of the chains? Um, Now, when we look at how we transform the depression, I mean, things happen around us, and we always find reasons why things are happening. But sometimes we tend to forget who we are and how we see things happen and how we interpret things that are happening. So when we start teaching about depression or start talking about depression, we also need to look at ourselves, and a lot of people, they experience despair when things happen, and it's very difficult to convince people to have hope. And the only way for people to have hope is when they start looking at who they are and what are they struggling with and how can they break away from their struggles. So the issue of identity comes to forth because you need to look at yourself as an individual, know who you are. Self-awareness in this state is very crucial. Okay. Again, I'm still on the chains. On the chains, again, we're saying in our society, the problem with the stigma around mental health is really about the stories that we tell ourselves as a society. Even when we suffer from depression, people have got their own interpretation. Different societies will interpret it differently, and different societies will also find indigenous approaches to resolve the issue. Okay. Now, when we look at women, maybe women with mental health or maybe women with depression, when I look at women who came before us, women who actually changed the world, the question that comes to mind is how did they cope when they encounter struggles? You look at your Winnie Mandela, her life was not as easy as people thought. She went through struggles, but she carried on and she soldiered on. And did she have depression? We don't know yet because people sometimes they don't tell their stories. They don't tell the negative side of who they are. And if you look at your Diana, you look at people that came before us long time and who succeeded in their journeys, they also have struggles. But now, hence I'm saying, when we say we in chains, it doesn't mean that they were not in chains as well. They were in chains, but how they broke away from those chains, that's one thing that we need to admire about them. So, if I look at what this other one has said, you must never be fearful about what you are doing when it is right. And in that struggle, when you're trying to prove who you are, when you're trying to prove a principle, you will go through those kind of struggles. And sometimes you will be depressed. Okay. Now, I spoke about your identity, and identity has to do with your own self concept. And when we're born into this world, we born, I think that's one thing that people say all the time, that your mind is a tabula rasa. So we learn certain things. So no person is born with a self concept. The self concept is believed to develop as person grows old. This means that our perceptions towards ourselves can be shaped and can be altered and can also be affected by environmental factors. So your upbringing, environmental factors, they do shape who you are as an individual because we learn these things as we see them. And sometimes to change, yes, people can change because of the surroundings around them. And that's when you can be able to build your self esteem. That's when you can be able to destroy your own self esteem. So, whenever you've got positive thoughts, those positive thoughts are going towards building your own self concept. But always, if you have negative thoughts, those negative thoughts are also contributing to your level of depression. Okay. Depression. To free ourselves from the chains. And I did say your identity. And identity is a lot of things. It's your beliefs, it's your family, it's your work, it's your practices, it's your choices, it's your reactions, it's your appearance. So it's a whole lot of factors. But they also include your environmental demands. And some people cannot cope with environmental demands. And that can also affect their identities. Now, if you look at understanding the depression, now we look at the definition, we look at the burden of depression, we look at the causes and treatment, we look at the risk factors, the diagnostic criteria, prevention, and and the and the summary. So the definition of depression, the people always say it's a common mental disorder. Like I said, it's a mental health issue. So other people will say a depressive disorder is a syndrome, chronic or recurrent, and there's consequences if it's untreated. And other people would say it is a state of mind, and others would also say it is a disease. So there's different kinds of depressions anyway. So when we look at some of the people that people present with, you find that people have got a depressed mood. Sometimes they're feeling guilty. Sometimes they've lost their pleasure. Sometimes they can't sleep. Sometimes they don't have appetite. Sometimes there's poor concentration. And remember, these are normal reactions to normal stresses, everyday normal stresses. But there is, at some point, they become what you call the depression. Now, it can be a serious emotional condition and it can affect how you feel, how you think, and how you act. I always like this quote where it says it's like drowning but not being able to die. You know, you just hanging out there, you don't know whether you're gonna die or not, and you just see this black cloud. When clouds are gray, what you normally see is just a black cloud. So even when people want to rescue you, you just feel people cannot rescue you because you're just feeling alone. Yes, with the symptoms again, you still experience low energy and fatigue. You still experience increased guilt, hopelessness, ineffectiveness, and you can't find any coping skill, even though you have coping skills. And again, what I want to say about depression, it's not about your intellect. Depression hits the very intelligent people. Depression hits people who are not educated, people that are educated as well. So it's a very sensitive disease. Okay. Now, I spoke about some of the symptoms, but there's added ones as well. There's what you call helplessness. So you just feel you can't help yourself. Sometimes you're feeling guilty. Sometimes you become very angry. You're withdrawing from friends. There's a thought of death. And that one is a serious one because depression has been associated with suicide. And changes of appetite, energy loss, you've got sleep problems, alcohol, and drugs. Other people, they will turn to alcohol or maybe to drugs. Um, Again, these are the very same symptoms that I spoke about. But what happens is when your emotions can't keep up with whatever is happening around you, your emotional system jams up and signs off. So you see the person becoming numb, just numb, and you don't know what is happening. And sometimes you want to help, but the person doesn't let you to help. And is it your space to help? Are you allowed to help? Okay. And as people will always saying, we see somebody that's being sad, and we think depression feels like sadness. But what actually happens is what depression actually feels like. It's hopelessness, people being isolated, people having anxiety, people having the guilt, people having emotional equivalent of watching paint dry. So the depressed person, it's very difficult to get to that person. You can do whatever, you can give the person money, you can do whatever, but you just don't get to where the person is. He himself or her herself knows what state is it in. Okay. Some of the examples again here, we're saying there's too much worry about stuff you can't fix, stays you up. The second one, your brain tries to deal with the strain by doing lots of dreaming. Too much dreaming means too little deep restorative sleep. So you wake up exhausted and start worrying all over again. So it's like it becomes a vicious cycle. Then let's see. Now, when it comes to the burden of depression, I think worldwide you can see the stats. Over 322 million people suffer from depression worldwide. And as a result of that, we also have, they're saying there's a loss of 850,000 lives every year because of the disease itself. Um, I'm not going to dwell much on that. And then again, internationally, it is the leading cause of disability worldwide, and it's a major contributor to overall global burden of disease. We're saying it's one of the most debilitating conditions on the world, with severe depression rated in the same disability category as terminal stage cancer. Um, Here, did you know that in the United States of America also it affects over 18 million adults, 1 in 10 in any given year. It is also the leading cause of disability for ages 15 to 44, is the primary reason why someone dies of suicide about every minute. Um, in South Africa, they're saying 70% is the percentage by which women are more likely than men to experience depression in their lifetime. So, more women are more susceptible to depression, and 11% is the percentage of adolescents who have a depressive order by the age of 18. So, before they even finish standard 10, grade 12, they're already in a depressive mode. Again, in South Africa, it is frightening also the fact that around a fifth of all South Africans will experience a depressive disorder at least once during their lifetime. Um, and the biggest danger of anxiety and depression is the risk of suicide. So normally, what happens is you find people who are depressed, then they become very helplessness, and they also become hopelessness, and then they develop what we call suicidal ideations, meaning they start to think about suicide, and they don't just go depressed and they become suicidal. They become depressed, then they have suicidal thoughts, and then they commit suicide. And a lot of men would 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 when they try and commit suicide, they do it intentionally and it happens. A woman, it would just be a call of help. They have those thoughts and they try it. There's a lot of attempted suicide in women, but they don't succeed. Men, when they attempt, they succeed. Okay. So again, what we need to look at again is life is about relationships, about connections and understanding, support and and empathy. So a lot of women and a lot of men in intimate relationships, they tend to suffer from depression because of not being able to understand each other and not having the right connections that they're looking for. Depression also happens in companies. And again, when it happens in companies, it affects productivity, it affects engagement, it affects the civility that happens in workplaces. And I think a lot of productivity has been lost because of the disease itself. Let's see. Okay, we go to the last part. So there's also myths about the depression, and they say it's always triggered by something. Sometimes it's not even triggered by something, but most of the time you might find that there must be an event to trigger the depression. Um, but so that's why I'm saying they always say also illness has its own separate entity. And again, other people will say isn't a real illness. It is a disease. It is a disease because there's some chemical imbalance that happens. Um, People get antidepressants, and some people are for antidepressants, others not. And people will always say they alter your personality. It depends on different personalities still. And they say depression is a sin. It is a medical condition, it's not a sin. And only women get depressed? No. Even men get depressed. So stressful events are more likely to cause depression in men. Men, when they are very stressed, they would manifest with depression. But if you look at the behaviors are different. For those that are in merit, in 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 marital relationships, men tend to be more irritable in their relationships, and that is also a sign of being depressed. Okay, what's up?
So for this,
You can ask.
doctor,
Mm.
can you just put in simplest term a difference between stress and depression?
I'm coming to that, I think.
Okay.
Yeah, I'm coming to that. And if you look at the risk factors, maybe the risk factors and some of the causes, sometimes it's genes, and that's why they say depressed mothers they tend to give birth to depressed children. And in biology, again, it's about sometimes there's an imbalance in the chemical reactions, and then sometimes even lifestyle. They said your poor diet, your lack of exercise, irregular sleep patterns can also be the risk factor and can cause some kind of depression. The environment, I said environmental demands, exposure to traumatic events, violence, low socioeconomic status, unsafe communities. So you can imagine people living in unsafe communities that sometimes the depression can actually increase the risk of depression. Okay. So now, if you combine this with some of the causes, we have certain medications. Some people used to say the medication with high blood pressure sometimes causes people to be depressed. So, and it's not the only one. There are a lot of other medications that can actually put you at the risk of depression. The conflict, depression may result from personal conflicts or disputes from family members of friends, and that's why they always say you need to act civil with one another, and you must always make sure that your relationships are actually intact. Death or loss is very traumatic, and when people go through trauma, there's also a risk of one being depressed. So it increases the risk of depression. Genetics, family history of depression may increase the risk. So it's thought that depression is passed genetically from one generation to the next. The exact way this happens, though, it's not known. And hence, when I started, I said, let's unlock these generational chains, because the chains did not just start with us. It's just that now we're realizing the chains now. Major events, even good events such as starting a new job, graduating, or getting married, can lead to depression. How many times did you hear the couples that are getting married fighting and somebody's depressed just before the wedding? So, whenever there is some kind of an adjustment in your life, whether it's positive or negative, there's a likelihood that that can cause some kind of depression. Okay. How many minutes left now?
And just check on the time.
Okay, so it's 13 minutes left. I'll just be quick. And then also just to mention other risk factors here. We've got the history of abuse, we've got death in the family, the mental health condition, the bullying that happens in the workplace, and more especially in the workplace, and relationship problems, losing a friend, and suicide and previous suicide attempts. So these are also the risk of suicide. So now, if you look at the signs of depression, what happens in your head as well? In the brain, we've got what you call the prefrontal cortex, which takes care of our rational thinking. Then we have one that we call the limbic system. The limbic system is about our emotions. So now, imagine if you're clouding your brain with stressful events, or you cannot react to what is happening around you. So you find that now in the limbic system does not function. And even the pre-cortex, it shuts down. So if your pre-cortex shuts down, then it means you cannot think properly. So there would be impact even in the workplace, because if you're not focused, if your attention is low, your concentration is low, it means that you cannot function optimally. Okay. Now, if you look at stress as well, normally people, they might want to confuse stress and depression, but stress is likely to cause depression as well, because remember, when you overly stressed, it depends what might be stressing you. You might have overload of work. Doesn't mean that when you have overload of work are you depressed. No, you get into the stress mode first, and then you have to find ways of handling your stress, and also you are reducing your level of stress. If it doesn't get reduced, that's when now you see the person starting to be sad. You can be stressed and not sad. Be sad. Hence, and the level of sadness, if it increases again, it's what you call the depression. So people, they've got different ways of relieving their stress. They'll go and jog, they'll go and listen to music, they'll go to spa, they'll go for therapy, they'll go for yoga, they'll go for nature. So there's different ways that we try and control our stress levels, because you don't want them to extend to other levels and become some form of depression. Okay. And then also stress, it happens in the brain. Again, you've got the brain that's not stressed, and you've got the brain that's stressed. So the brain that's very much unstressed, you find that people are very attentive, they perceive the way they're supposed to, they've got memory, they can learn, they can use words. But if in the brain there is some element that you are stressed, you might find that now you will experience emotional distress, you'll experience inadequate sleep, and then we tend to call it chronic stress. Let me not go deeper. So, the architect, what do I mean by the architect? Nowadays, when we look at the reasons why do people become depressed, okay, we go back to our brain, but we're not finding the answers that we're looking for, and that's why now, for us to be able to survive as individuals, we also need to look back at the heart. How can the heart actually play a role in making sure that we alleviate the element of depression, or we reduce depression as such? And when with the heart is actually the foundation of emotional intelligence. I'm sure you heard a lot of people talking about emotional intelligence, but all the elements and the facets of emotional intelligence, you can see they're explained by the heart elements still. So now, what do people need actually to defeat your fear or your anxiety or your depression as such? So this person says, I found that recovery means being honest about what I want, what I need, what I feel, who I am. How many times have you heard people saying, but I wasn't honest with myself? I wanted to do this, I could not. Expectations. Clear your own expectations and know who you are, what you want. And at the same time, it doesn't mean that when I'm saying you must know what you want, you must be self sufficient. And I'm not also saying be and you know it all. Always consult with others just to check that you're still in the right track. Now, if I look at the diagnosis for depression, we have what you call the DSM-4. That's our guide in terms of us having to diagnose if someone is depressed. We look at least five of the following during the same 2 week period, representing a change from previous functioning. It's either the person has got a depressed mood, diminished interest, significant weight loss, insomnia, psychomotor agitation, fatigue or loss, feelings of worthlessness, diminished ability to think, recurrent thoughts of death. So at least you must have five of those symptoms. B symptoms do not meet criteria for a mixed episode. Symptoms cause clinical significant impairment of functioning. Symptoms are not due to substance or general medical conditions. Symptoms are not better accounted for by bereavement. So this proper diagnosis of depression is very crucial still. So only psychologists, psychiatrists can actually give you a diagnosis. No. The 7 steps for conquering the depression also, I think it includes what we call self care. So if you don't take of yourself, then you won't be able to conquer that. I mentioned that we need to go back to our heart when we're tackling the issue of depression because that's the foundation for emotional intelligence. And we're saying people are more ready than ever to learn how to connect with their hearts. With humanity at stake, many are looking deeper into their hearts for answers. So we need to look at humane ways of doing things. Science is verifying the heart's role in feeling and also intuition. Only through the heart could fear be replaced by love. Remember, when there's a decision that has to be made, sometimes people say, but use your heart, to look for direction. Or if we are to forgive someone, we always talk about the heart. So it means the heart has a forgiving nature, and the heart has got the softer way of dealing with issues. Okay. Now, even when you're looking at practical approach on how to solve depression issues, we always say focus on the heart. So the technique that we normally use is heart focus, heart breathe. Even when you practice breathing techniques, you need to breathe from the heart. And even when you feel, start feeling from your heart. Some people don't even know what the heart does. Some people don't even know what the heart because we always give 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 preference to our minds, and we give preference to our precortical cortex because we're saying that's where we can think rationally. That's where we can be able to make the decisions. That's where we can make the decisions quicker. We can memorize. We can be seen as clever. We can be seen as good. But and then people with hard focus, people sometimes don't want to take them seriously because they're saying you are soft, you are lenient, you don't show confidence. Okay. So self-care approach again is about taking care of yourself. So some people always will will always rely on religion to assist them to fight the depression. But again, it's about people's beliefs, it's about people's awareness, it's about people's environmental demands, their physical conditions, acceptance. So you cannot change people's thoughts, but I always say you can be able to influence people. So always you need to listen to what people are saying. So depressed people, all what they want to know, all what they want you to do is to listen. So normally I'll sit in with participants and we'll draw up like a self-care plan on what people are willing to do. So this is just an example of a self-care plan. Okay. Okay. And then again, your thoughts, you are stronger than the depression itself. So how are you today in terms of your self-care approach? So all the slides is about the do's and don'ts. Again, don't offer quick fixes, don't tease or joke, don't say it's all in your head, don't try. So this is when you're trying to help other people battling with depression. All what they're saying is you need to listen. You need to validate that they have an illness. You need to offer life tasks, help with life tasks, and then keep trying and be patient. Don't tease the people. Don't try to relate to them. Don't offer them quick fixes like I'll give you money, then you think that the person the next day will be okay because it's a quick fix. Okay. So just be you, love yourself, believe in yourself, you become what you believe. So I did say these are self-help approaches. So let's see. And social approaches as well. I think I was teaching about wealth, and then I came up with the principle of mercy that in life, people always need money, they need experiences, they need to be resilient, they need safeguards and intentions. And then, in short, money obviously it means you need to work, but how you get that money is a problem again, because now you have to go through the right route. You have to take the high route to make sure that at the end of the day you're well equipped and you have skills that you can be able to work and earn money. Experiences, we need positive experiences as opposed to negative experiences. Even when you have kids, you need to take your kids out, you need to show them what is happening around them, or what are the demands of the environment. Resilience, things would not just go as positive as you think. There'll always negative capability that actually exists. So people have to be resilient. People have to know exactly how to bounce back when things have gone astray. Safeguards, safeguard is about protection. Tell people protect yourself. Be strategic in whatever you're doing. As managers, we always say, what are the risk factors? You look at the risk factors and you try and mitigate the risk. Even with your life, what would be the risk factors? How do you mitigate the risks? So people always fall into traps unnecessarily because they never had safeguards. Intentions, have good intentions. Have ambitions and good ambitions, not bad ones. Okay, I'm trying to go to. So you are the master of your destiny. You can influence, direct, and control your own environment as women. Um, and this is my business card in terms of therapy. I'm based in Fourways at the moment, but I'll soon be in Pretoria. So for further engagements when it comes to issues of depression, that's my business card, my contact numbers. Yeah, I think that's all in my company. Thank you.